So friends, as promised, let us start with our educational video on diabetes. So what is this diabetes? जिसे हम मधुमेह कहते हैं हिंदी में. It basically means excessive sugar in the body. What is the definition of excessive sugar? So if your fasting blood sugar, bhukhe पेट पर, is less than 100 milligrams and 2 hours after lunch is less than 140 milligrams and जिसको हम 3 महीने वाला शुगर HbA1c, hemoglobin A1c is less than 5.7, तब हम कहते हैं कि the sugar is normal. Between 100 to 140 fasting, 100 to 125, fasting, and between 140 to 200 post lunch, and the 3 months ka sugar between 5.7 to 6.4 is called pre-diabetes. And beyond that is frank diabetes. That means आपका sugar अगर more than 140 fasting, more than 200 post lunch, and HbA1c beyond 6.4, then you are a diabetic frank. So ये तो हो गया definition. What are the types of diabetes? तो हम कहते हैं type 1 diabetes, which is called insulin dependent diabetes, or type 2 diabetes, which is common, which is where there is deficiency of insulin. Insulin कम है body में, pancreas produces less, or more often there is resistance to insulin. That means the insulin doesn't act. The more you eat sugar, the more insulin which is to be produced, the body is resistant to that. इसलिए sugars बढ़ जाते हैं. So that's the type 2 diabetes or the non-insulin dependent diabetes. Then there is a third variety called gestational diabetes, जो pregnancy में होती है, around second or third trimester. Quite often it is only temporary and it may or may not transform into full-fledged diabetes. So हमने देखा diabetes is due to deficiency of insulin. If insulin is just not produced at all, it is type 1. If it is produced but is less or resistant, then it is type 2. So what causes this? Quite often it is hereditary, and quite often there are other factors which add on to it. So these you can call it as precipitating factors. Yani, if you have in addition those factors, then you are more likely to develop diabetes. For example, obesity. If your BMI is more than 25, you are overweight. In addition, a sedentary lifestyle. Then we have what is called as increased visceral fat. Now, more often, if your food also is high calorie food, then that also adds on to it. In addition, stress is another feature which precipitates high blood sugar. So it is hereditary plus environmental, lifestyle together that can cause diabetes. So remember, we have defined diabetes, pre-diabetes, and normal sugar. Now don't kind of ignore what is called pre-diabetes. As we had mentioned, more than 5 crore people are diabetic and almost 7 crore people are pre-diabetic. Many of these pre-diabetics will eventually get converted into frank diabetes with all its problems. So friends, stay tuned. आगे हम signs and symptoms, how do you diagnose diabetes will do, and then what does diabetes cause for which we are all worried. मिलते हैं next time, maybe tomorrow. Thanks.